Sebastian is going to have puppies. Yay, puppies. We have been married for almost 8 years, and we tried for a baby for 5 years.
Ever since I was a kid, I've wanted to be a dad. I mean, I've been telling dad jokes since I was a kid, so it just follows.
The little ones brought us nothing but joy. During the anatomy scan, about 24 weeks, they just noticed that Ella's heart was on the wrong side of her chest.
It was a little bit scary. They said, you know, hey, well, her heart's on the wrong side. We should probably check it out just to make sure. And
so that is supposed to be there.
We first diagnosed Ella with a fetal echo. Her mom was found to have twins, and one of the babies had a congenital heart disease.
Sometimes when there's a really complicated fetal diagnosis, the fetal doctors call us and we look at that in advance. So we were aware of Ella from early on.
We kept hearing repeatedly, like, here's our plan, but it's all going to depend on what we find when she comes out, just because they couldn't get the best glimpse of everything, and it was hard to say if they had an accurate view of what was going on.
This is an actual model of Ella's heart. In Ella's case, it's turned around so that the bulk of the heart's over in the right chest.
Due to the complexity of her heart, we weren't 100% sure exactly how to repair it. A lot of discussion with other cardiologists and surgeons, we decided to do a cardiac CT, and from that, do a 3D print.
So for a long time, Primary Children's has really been a leader in providing cardiac care. This is really exciting that this technology is available. This was the first patient that we were able to print up a 3D heart. I think this is a great example of pushing technology to new limits. Our routine cardiac imaging is great, but with Ella's unique anatomy, we were able to go to a whole nother level of understanding of her anatomy. And as we work with the clinical team, they're super excited about the possibilities that with other patients that do have this unique type of anatomy, that we'll be able to get a greater understanding and provide even better outcomes for our patients moving forward.
Having something that you can actually turn and rotate in your hand and see relationships and have an appreciation for the distance that we're talking about is helpful.
Got it color-coded so they know what they were looking at, because her heart's not textbook, so it was so cool to be able to look at it and be like, this is what we need to do.
when he was just looking at the scans, that he didn't think he could make it happen. But then once he saw the 3D heart and was actually able to take it apart and look on the inside and look at the actual heart itself, I mean, that 3D print basically saved her life. I mean, it's what led to the surgery being successful.
Primaries is all about putting the child first, and this is just a phenomenal tool that will help make sure that every child has a better chance. Their lives will be just as changed as Ella's, and that they'll have the best outcome possible.